A lot of patients come to us and ask about how to see their MRI for slip disc. So basically they want to understand how does a slip disc actually looks like in an MRI. So come, let's understand through this MRI film what type of slip disc is there and how to identify it. So when you will get your MRI film, there will be a cut like this. This is known as the sagittal cut. So in this cut you will see square structures like this. These structures are the vertebrae or the bones, and you will see a thin sheet-like structure between them. This is known as the disc. So this is the disc and this is the bone or the vertebra. And from behind these two structures, longitudinally runs the nerve like this. So normally a disc is never supposed to come and push or press this white structure, which is the nerve. So you can see here that the disc is not pushing this white thing, here also, here also, here also. But when we come here, we can see this large black piece of disc that has come backwards and it is pressing the nerve. So this is basically how a slip disc looks in the sagittal cut of the MRI. Now this big disc part that has come towards the nerve and pressing it might cause pain in the legs, or radicular pain, what we call it. It can cause numbness, tingling in the leg, or problem with the motion and urine nerves also. A second type of cut that you often find in your MRI film is the axial cut. So this is a typical axial cut. Here this circular thing, this is the disc area, and behind this is the bone, and between the two things we have nerve passing from here. So normally the disc never presses the nerve here. But when you see in this cut, this black thing is coming backwards and it is pressing the nerve. So this area is normally taken by the nerve. But here we see this black thing is coming back and it is occupying the area that was supposed to be occupied by the nerve. So there is a nerve compression because of disc prolapse in this MRI. And this nerve compression here can give rise to symptoms of pain in the legs or claudication or numbness, tingling. Depending on the location of this disc, patient can have varied sort of symptoms, but overall this is how a slip disc looks in the MRI.